everyone. Come on in to All Things AuD. I'm Dr. Natalie Phillips.
I'm Dr. Hannah Galloway.
And I'm Whitney.
All right. So let's start with let's move this here. YouTube channel. I have Dr. Galloway talk a little bit about this.
Yep. So here's our YouTube channel. You can see we have 63 subscribers. I think last time I checked, it was 58. So we're gaining subscribers. If you kind of scroll down here, you can see different thumbnail images of, what the show is about, and you can find older episodes. That Redux episode was really popular. That was my infomercial where I dipped the hearing aid in water and then put it in the Redux. But you can see here, there's different topics, and you can, send them to people that aren't on Facebook or Instagram. So subscribe to us, and then that way you'll get a notification every time we have a new episode. We try to be here every week on Thursday.
Yeah. Okay. So we're going to talk about ear infections today, but I'm going to have Whitney kind of introduce why we're talking about this subject.
Yeah, so I have a pretty large group of my friends are actually moms, and they have kids anywhere from about 5 months old to we have some little kiddos that are 4 years old. And so because I'm in grad school for audiology, when their kiddos get an ear infection, they always text me. And so, we were kind of brainstorming, what we should talk about today. And just with temperatures getting cooler, I feel like sickness and things like that is just, more prevalent when the seasons change. And so I thought, what a good topic, because ear infections, they're so common, but I think for parents, it's a little bit like debilitating because they don't know what they're to do. Their child isn't feeling good. Their ears hurt. So I thought, what a good topic just to kind of shed light on. It's super common, but I don't think you can ever have too much information on it.
Yeah. Okay. So we are going to talk a little bit about types of ear infections first. So I will have Whitney kind of go into the first type that we want to talk about today.
Yeah, so there are actually multiple types. So the first one we're going to talk about is otitis externa, which actually just means infection of the outer ear. So this type of infection is actually in the ear canal. So we can actually, yes, our lovely model.
So anything from the ear canal outward is going to be otitis externa. So anything that's just kind of like outside of the eardrum or closer to the outside of the head.
Mm-hmm. So this one, we typically can easily see it when we perform otoscopy, looking in the ear with our little flashlight. Typically, we'll see, symptoms of like yellow or whitish residue in the ear. So it's going to look different from maybe earwax. Typically, there could be some swelling and redness of the ear canal just because we do have, some type of bacteria infection kind of festering in there.
We didn't want to put any pictures up, by the way.
Yeah, no.
We do have some pictures for this show, but we didn't want to put pictures.
Yeah, this one.
These people are having lunch and enjoying our show over lunch. So
yes. This one is a little bit like you, even as a parent, or if you've ever had this, you'll kind of know. There can be hearing loss because we can get so much stuff in that ear canal that we're blocking sound from actually reaching the eardrum. So you're going to have hearing loss there. They might be itching at their ear pain, might be tugging at their ear. So those are maybe some, without looking in the ear, some cues of, there might be something kind of going on. Treatment for that typically is some type of otic ear drop. So something that you're just going to be placing in the ear, and then trying to keep that ear as dry as possible. So trying to avoid water, things just, keep festering, and the more moist we keep it, it kind of thrives in that environment. And so trying to keep that ear dry will hopefully kill off that bacteria.
Yeah, and trying to keep your ear dry can also mean like you can come in and we can do, or you can go into an audiologist's office and take ear impressions to make custom earplugs. So that will help you when you take showers or if you're swimming or whatever it is. The dry ear precaution is typically what is recommended for otitis externa. Yeah. All right. Okay, so we're going to move on to another type of ear infection, which is otitis media, and I'll have Dr. Galloway talk about that.
Well, let me get my little model here so we can see. So if you can kind of orient yourself, we've got our eardrum, and it is right here, this sort of little plastic representation. So anything back behind that before the cochlea, which is the little snail-shaped guy right here, is going to be a otitis media or middle ear infection. So I know we've kind of got some glare there, but that kind of helps you see this little pink tube here. This is the eustachian tube. So that's what connects your ear to the back of your nose and throat. And that's where, if we're having problems with the eustachian tube and it's not equalizing pressure, that's when we can get an ear infection, because we have fluid that builds up back there behind the eardrum, and then there's nowhere for it to go because that eustachian tube is not opening and closing like it's supposed to. The fluid backs up, and then there's fluid just sort of surrounding those middle ear structures. When I was a kid, they taught it as, the hammer, the anvil, and the stirrup. It is the malleus, the incus, and the stapes. So those three little bones in your middle ear are very important. And when they're surrounded by fluid, they don't move as well. Your eardrum moves different. And that's when we have otitis media, or that's what probably the more common type of ear infection, that when someone says ear infection, that's what you think of.
Mhm.
You might need antibiotics to get rid of it. Sometimes kids can get tubes put in their ear to help with that. So if you're, going to be looking in the ear canal, so if you're a parent or, something like that, yeah, you might see the kid pulling, tugging, trying to put their fingers in their ears or something like that. It might be red or like hot to the touch. And that can just be from messing with it. You get more blood supply. If you have an otoscope, or, you go to your pediatrician and they look in the ear, what they're going to see is the eardrum back there might be kind of bulging because there's a lot of fluid behind it, or there might be bubbles that they can see from behind the eardrum that would indicate that we have fluid back there. There is a test that we can do in the office called tympanogram. We put a little tiny probe in your ear, and the probe actually puts pressure in your ear and then removes it and measures how much your eardrum moved. So a normal, healthy eardrum is going to move back and forth in response to that pressure being put in and removed. If you have a lot of fluid back there and that eardrum is not moving, that also indicates to us, hey, this eardrum's, not moving, and so we need to do something to help with that.
Mhm.
Whether it be, oral antibiotics. Typically they're going to do oral antibiotics like amoxicillin or something like that. But that would be, something that you go to the ENT or the pediatrician, and they can definitely, decide if it is or if it is not an ear infection. So if we have an ear infection and we have a lot of fluid back there, if you go up on an airplane, sometimes, or if, you blow your nose really hard, sometimes people can perforate their eardrum. That just happens because you have a whole bunch of fluid back there and there's nowhere for it to go or release that pressure. So it may actually bust through the eardrum. In the moment, your child, it would probably be alarming, but it would probably feel better to them and be less painful because that pressure has been able to release. But you would find, maybe some drainage on their pillow, or, some sort of discharge to let you know that something like that had happened. There might even be some blood too. So those would be kind of things to tip you off. But definitely, ENT, pediatrician, primary care, somebody can look at that and decide, what needs to happen next. In any case, we want to be doing hearing tests, because that way we can tell, if the hearing is compromised. And then after we get rid of the ear infection, we want to test again and see that it's improved. It can be kind of all over the board. You can have a really, really minimal hearing loss with an ear infection, or a pretty significant one. So it depends on how thick that fluid is and how much it's keeping those structures from moving. When it's really, really thick and it's more of almost like a mucus, we call it glue ear. So it's literally just like glue back behind that eardrum, and nothing's moving. That's kind of the most severe type of middle ear infection. And so there's a big spectrum. We also want to make sure we're not having too many, independent ear infections. So definitely don't try to just treat it at home on your own. Even me with a clinical grade otoscope at home, I ended up taking my son to the ENT just to say, okay, there's fluid. It's been there. I'm watching it, but how long, can we let this go before we're concerned about his speech being too delayed? So I would advise reaching out to a professional. I know, especially in the mom seat, it's hard to know, do we go to urgent care? Do we not go to urgent care? What are we going to do? But it's better to be overcautious than not. The worst thing they're going to do is say, yeah, it's an ear infection, or yes, there's fluid, but we're not going to treat it. We'll just keep watching it. But they might have other recommendations too. My son is doing Flonase. And so that's a nasal steroid that's helping him keep that fluid, keep the eustachian tube working better so that he's not having that fluid buildup. And we're just kind of watching and waiting. So there's sort of different recommendations based on how significant it is, if it's the first time it's happened, or if this is something that's a repeated occurrence that we're dealing with. So on your own, there's only so much you can do, but it's good to at least have a doctor look at it, make sure we're not totally missing something or letting them go on and on without intervention.
Yeah. And we have quite a bit of people kind of coming on. This is probably a really good topic, Whitney. So thanks for bringing that up. So if you do have questions, because this is the live show, we want to make sure that you can ask us while we're here, or if you have questions later on, you can always put it in the comments, because we're doing this on Facebook. We'll post it on Instagram, and it's also going live on LinkedIn and YouTube. So if you have a question, put it in the comments, because we'll be able to see it as we're kind of talking here. So we talked about otitis externa, which is on the outside of the eardrum, like what we can see when we look in. We've talked about otitis media, which is on the other side, the inside of the eardrum, where we have to kind of you might see some different things when you're looking at the eardrum or from the test or things like that. As an audiologist, we can take a look at that. So we're going to also touch upon just a couple of other ear infections that are considered ear infections. And sometimes people use these terms for these types of ear infections for a lot of different things. Sometimes they're but they're really specific, actually. So we thought we'd talk about these other types of ear infections as well. So the first one is called swimmer's ear. So if you've heard of swimmer's ear, it is a form of otitis externa because it is from the outside, and it's on the outer part or the lateral part of the eardrum, where if we were to look in, we could see. I'm going to try to pull up a picture here too, because I want to show you this, but really otitis externa or swimmer's ear, this particular type of otitis externa, it's an inflammation or infection of the outer ear canal due to the fact that water gets trapped in the ear canal. And after maybe you're swimming or you go into a lake or something like that, and it can create bacteria or fungi, right? And so people are like, well, how does it get trapped in my ear? Can I just bounce up and down and it comes out? Well, yeah, sometimes you can, right? And sometimes it does evaporate. It depends on the consistency of what's in that water, but then also it depends on what's going on with the ear. So some of the symptoms that you might see with swimmer's ear is the pain, swelling, itching, fullness. Maybe if you're moving your jaw, you can feel a squishiness in there. And so again, people sometimes have a hard time getting this water or whatever was in there that's trapped in that ear canal. So let me see if I can pull up this picture, because I wanted to show you. I worked in California for a while, and I grew up in Hawaii. So I think what's interesting about this is that it is, I never knew about exostoses, which are these bony growths in the ear, until I worked in California because of the cold water. So a lot of surfers would come into our clinic, and I'm going to let me take down just a few things that are covering this. Sorry, give me 1 second. Okay. And actually, I'm going to take down this banner so that you can kind of see. Basically, what we're looking at here is we're looking at, on the left side, that healthy ear canal. So when we look into the ear, we look past the ear canal, and that's what we're looking is at the eardrum, I should say. Healthy ear canal, eardrum, really healthy on the left side. The right side is the exostoses, or the surfer's ear. So when you put yourself in cold water, here even in Colorado, if there are people that go kayaking or something like that, right? Or there may be guides, or, the surfers that I used to see in California, you get these bony growths that push out from underneath the skin in the ear canal. And that's what it looks like on the right-hand side. So if you can see, like you can hardly see, you can see that blue arrow that's looking at that eardrum, but it's narrowing that ear canal, right? And so if you're going swimming, that's how people have a hard time getting that water out. And so it kind of festers behind that. The eardrum is deep in there. It festers behind there, and they have a hard time, like even if they were to jump up and down, like to get that water out. So it can sit there for a long time and create bacteria or fungi. And so this is called exostoses or surfer's ear, but this is what contributes to swimmer's ear. So swimmer's ear is a form of ear infection that's otitis externa because it's on the outside of the eardrum, right? And so that's one type of difficulty that people can have. A lot of the times people that do have ear infections here, like they have to go see the ENT to constantly get that suctioned out, or they have drops that kind of help evaporate the water or fluid or whatever it's been in that ear canal. So we just kind of wanted to show the healthy side, and then what exostosis is, and what can contribute to swimmer's ear, which is a type of ear infection that we wanted to talk about. The other one that I wanted to talk about is actually one that my daughter experienced. And so this one is called air otitis. And I was flying out to Hawaii, and it was interesting because my daughter was really young and she's had multiple ear infections. But when we got there, she was complaining that her ear hurt a lot. And so, as a good audiologist that I was, I shined my phone light in there, and I could see that it was bright red. I couldn't see too far in with just my phone light, but I called a friend there in Hawaii, and I said, "Hey, can we come by your clinic and can I run a TIMP on my daughter? And can I take a look in her ear?" And so she said, "Yeah, sure, come on in." So we went into the clinic, and I told her what happened. She goes, "Oh, it's air otitis." And that was the first time I actually heard that. I had no idea. I don't know if you guys have ever heard that. So I had to look it up. I was like, what is that? Like, I've been an audiologist for a while, but I don't know what air otitis is. And so when I looked it up, it's ear barrel trauma, or sometimes it happens on the airplane, or even like if you're scuba diving, basically. But it occurs when there's an imbalance of pressure between one side of the eardrum to the other side of the eardrum. Okay. And when I actually looked in her ear with an otoscope, it, like, her ear drum itself was red and there were bumps on it. I was like, oh my gosh, what is going on? And of course, that's why she's just so uncomfortable, because her eardrum actually had bumps on it. And so, symptoms of air otitis would be moderate to severe ear pain, the fullness or stuffiness, the muffled hearing. But literally, there was nothing that I could do. And so we had to just give her pain medication to mitigate that pain while her eardrum healed. And honestly, it could have just been from anything. But I think with that difference of pressure change when we were on the plane, it might have just irritated her eardrum. But yeah, that was something I've never an audiologist before. So I thought we'd talk about it because it is a type of ear infection, but it was really interesting to see. So so we talked about otitis externa, otitis media, and then swimmer's ear, and then also air otitis. So if you didn't know what that was, then hopefully you learned something here today on air otitis. Okay, so the next thing that we wanted to talk about, and I'll have Whitney talk about it, is the question that we get is like, how many ear infections is too many, right? Like, I remember when my daughter was going through it, there was definitely something that was written by the American Academy of Otolaryngology. Like, they have kind of rules for ear, nose, and throats to say, okay, do we continue to give antibiotics or do we go to something else? So I'll have Whitney talk a little bit more about this question.
Yeah, so very common question. The Mayo Clinic ENTs actually suggest that if your child has had 3 or more ear infections within 6 months, or 4 within, I believe, the year, they probably benefit from pressure equalization tubes. So that's something that, as audiologists, we don't do that, but you would go to your ENT and there would be just like an outpatient surgery where they're putting they're so tiny. They're these little tiny tubes, and that's what they're actually putting in your child's eardrum to help release that pressure. So your child does essentially have a perf or a hole in their eardrum. However, as time goes on, and we have parents come in actually periodically to our clinic and have us run temps or that pressure test to make sure that the tubes are still open, that perforation is still present, because then that lets us know that, yep, that tube is doing its job. Sometimes patients come in because they want to see if the tube has fallen out. Our eardrum kind of grows in a spiral manner. And so eventually that pushes that tube out, and then you have a healed eardrum. Then it comes, are we getting more? Do we need to do another round of tubes? Things like that. But that's typically, 3 or more in 6 months or 4 in a year. That's when maybe a more medical what is that word? Intervention needs to happen.
Yep. Yes. And it's hard to keep track of them. That's why, if you've had 6 ear infections at home and you've never been to see anybody, number one, you're probably going to lose track about how many it's been, but then you're just reporting to the ENT, well, I think it's been 5. And it's really best that they've been documented either by your primary care or your pediatrician or the ENT. So that way they're actually going to, do something about it, rather than, of course, they're going to take your word for it, but they might wait until it's happened more times. So if this is something that you're like, oh, this is happening at my house, it would be worth, trying to go in and talk to somebody, even if you have dates, like we filled some antibiotics here and we filled some here and we filled some here, just to kind of let them know what's been going on. And if you haven't had any treatment and you've just been dealing with them at home, it's hard for them to know when was one ear infection and did it completely go away, or was this just the same one? And those structures are delicate. So we don't want, fluid to just be sitting back there for an unreasonable amount of time, because it can cause, damage to the ear. One thing that we often encounter is, why do babies get ear infections? Or what about a baby? What am I supposed to do? We do see babies in our office for hearing tests. And when you're born, you can have fluid back behind that eardrum for about 3 months, and they don't necessarily do anything about it. It's just considered normal part of, birth process. And a lot of times the body just absorbs the fluid and then all is well. Kids are more likely to get ear infections than adults. And this is why. So if you look at the picture of the adult versus the picture of the child, the eustachian tube, or that pink tube that I showed you that's kind of connecting the ear to the back of the nose and throat, you can see on the child's picture, the tube is sitting more horizontally oriented. So fluid could sit stagnant in there and really not be able to move. Whereas the adult, it's more slanted. And so just that, little slant of the tube is going to help fluid to drain. So that's, anatomically why we see that kids are having more ear infections, and the structures are smaller, they're growing, things like that as well. But if that fluid gets backed up in the eustachian tube and we can't clear it, we have an ear infection. And so, just kind of tracking how many of those there are, and what we can do. If you look at the very bottom right of this picture, you see that little blue, it looks like a tube. That is what a representation of a pressure equalization tube in the eardrum. So like Whitney said, it is like punching a little hole in the eardrum on purpose and then putting a plastic tube in it to hold it open so that the fluid can drain out, the outside of your ear rather than stay inside. So if your child has tubes and they sleep, you might see some discharge on their pillow. That's not a bad thing. That tells us that fluid is coming out that way instead of getting stuck the other way. So it's a better solution. But that's kind of what it looks like. And so you can see why kids or babies are going to have more of an issue than an adult. So that's something, if you are curious, we can, test or do like a temp or refer to ENT and kind of talk to you about what the process might be.
Yeah. I love this slide too, because the way that I explain it to people is, the eustachian tube is more horizontal as a baby, and then it starts to angle down. Right. And so that's why if there's any fluid that gets into that middle ear, it safely comes down the sinuses. Right. And that's how we blow our nose. And so this actually, I didn't know this, but it looks like it's kind of more 10 degrees in an infant or a baby. And then as you get to be an adult, it kind of goes down to that 45-degree angle. So you can kind of see that the eustachian tube kind of then comes out that sinus passage, and it's easier for us to get that fluid out. So I love this picture because it kind of gives you the actual degrees as well. So I have one bonus question. And so Whitney and Dr. Galloway have no idea, but I wanted to talk about this because I thought it would be kind of interesting. So I'm going to put it up here. Okay. So, or actually, hold on. I'm going to give you a little bit of background. So there is a place in town that of professionals that are not audiologists that say that they could help with ear infections. And I don't know if Dr. Galloway is starting to nod her head because I know that we've talked about this before. So my question is, what do you guys think about chiropractors and how they're able to prevent ear infections? Just like, what are your, I have some facts here, so we'll talk about it. But like, what is your initial thought as far as everything that we've talked about with ear infections? What are your thoughts about, like, can chiropractors help out with ear infections? Let's just pose the question.
Okay, so I have gone to not necessarily like the chiropractor, but let's say you go to get a massage and you lay on the table for a really long time and you're like relaxed and you're getting all massaged, and then you can like feel your eustachian tubes kind of like crackle sometimes.
Yeah.
It's not because anyone is moving my eustachian tube or changing its orientation. It's more of the massage and the movement of like the mucus through the sinuses and all of that. So I can see how the two are related, and how somebody can say like, oh yeah, after that massage slash chiropractic appointment, I feel like a lot drained out. Like I feel like my ears opened up a little bit better. But it's not changing my anatomy.
Yeah.
So for myself, maybe going to get a massage or going to the chiropractor, I might get a little slight benefit of feeling like I hear better because my eustachian tube opened up. However, I have seen professionals say, bring your baby in and we're going to, do a workup on them, and it is going to prevent them from getting ear infections. We can't change the anatomy, and they're not going to change the anatomy. But if your kid is really super congested and has a cold and those frontal sinuses are just full of junk, yeah, I see how maybe, even some like stretching or things like that, like doing some facial massage on your baby could help to, get some of that to drain. So I'm not going to say that there's nothing they could do that's helpful, but I don't think that they're treating it in the way that maybe the general public thinks they are. Like, oh, they're rearranging the anatomy and that's why this kid's not going to get an ear infection. That's not
right.
To me, that doesn't track.
Yeah.
But I have certainly seen parents or adults that said, I went to the chiropractor and, my eustachian tubes open up, I can hear better. But I don't think that it's really, making a permanent change. Maybe it's just some of that congestion being relieved, and that leads to feeling like you're, getting a little bit of benefit from your hearing, being adjusted. However, it's not going to, if you have a raging ear infection, going to the chiropractor is not going to help. If you have an infection and you need, antibiotics, you need antibiotics. So it's almost like treating the symptom rather than the cause. And with children, that's hard to do and delicate because they can't necessarily tell you, and the chiropractor is not looking in their ear. And so I could see problems with it, but I could also see how someone might sit up after a chiropractic workup and go, oh, wow, I hear better. So.
Yep. No, I see that. Okay. I get that. And plus I totally agree. Like with massages, like if my face is down, then like I can get stepped up. But when I flip over and it's like, okay, now it's draining. So I can see like it's temporary or, transient, I should say.
Yeah.
Okay,
it's
Whitney.
It because you heard popping and cracking in your ear.
Sure. But like this place is also talking about, bring your babies in, right?
Right.
Yeah. Okay. So, Whitney, what are your thoughts?
I don't know. Well, I guess I'm wondering what we're doing. Are we like cracking things up here? Because that stresses me out.
Right.
But I'm a person who like has went to the chiropractor like twice in her life, and it was because I was like walking over all bent. So I trust them with my back. I don't know. I think I'm not. I could see. I agree with what you guys are saying. But yeah, I just don't think that I would maybe like that would not be my first like, I'm going to go to them. I think there's other routes I would take. I agree. Maybe if it's helping you feel that way, there's nothing wrong with that, but I wouldn't use that as like my first step treatment. I have a question for you guys, just to kind of flip scripts. What have you guys heard? Have you guys heard anything about like certain baby bottles or pacifiers inducing like sucking to help, like, I guess, pop the ears or like release pressure. What do you guys like? What do you guys think
Oh,
about
okay.
that?
Well, I'll send it over to Dr. Galloway because like my babies are 17 and 19. So like, I mean, I'm sure there are things out there.
Yeah.
So, but yeah, I'll let Dr. Galloway take over if there was
Yes. So I have seen that if a baby is breastfeeding, there's a lot of suction to be able to get their food. And so that's going to be like the best sort of suction inside their middle ear. But what I have seen on like nipples of bottles is they're saying, oh, this nipple is going to help prevent ear infections because of the way that they've designed it so that it has more they have to suck harder on it.
Okay.
So they have some nipples that just have one little tiny hole in the top of it, and it's like slow flow, medium flow, fast flow, or whatever. And the baby doesn't really have to do anything. You can just hold the bottle upside down and it's like coming out. But then they're not having to like suck as hard to get all of that swallowed. And I see how you could still have some more like fluid in the middle ear. When they breastfeed, it doesn't just come out of one hole. It comes out of like a lot of different streams. So I have seen nipples, and I can't remember. I think it's MAM, M-A-M is the name of them. But they have designed the bottle so that like if you take the baby bottle and put it upside down and squeeze it, it's coming out of like multiple holes. So it's more like a breastfeeding. And I think that's where all of that's coming from. So anything that's suction, like sucking on a pacifier, that's going to help them, get anything out of that like middle ear area. Same for sucking on a bottle, but it's not all the same. So it depends on how hard it is for them, how hard they have to suck to be able to eat. And then again, kind of like clear that. There have been studies that babies' airways remain more open with pacifiers in their mouth. And so I think that, people have kind of a bad rap about pacifiers and things, and obviously they can have them too long. But when you start thinking about the middle ear and ear infections and that kind of thing, if we're on an airplane and your ear hurts, sucking on a pacifier can help relieve that because it's helping with their middle ear. So I have seen, I think it's more of a marketing thing to say like, oh, this one, your baby's less likely to get ear infections. But I think it's because of how they've designed the nipples. And then obviously the big take away is don't lay down and eat. So if they can't be laying flat on their back from any kind of bottle and eat, it's all going to get in their middle ear. And when they're breastfeeding, they're oriented so that their head is above their body just because of how you're holding them. But I think that's kind of the most important thing about feeding is how they're oriented. We don't want to do like supine feeding, but there are all kinds of different bottles, and I have been in the thick of it, and I've read all the instructional materials and everything. Yeah. And so there were times when my babies were doing either from the bottle or from the breast. And I felt like whenever they were congested, it helped them more to breastfeed, probably because there was just more pressure and they're kind of, able to get some of that out more. But
this is great. Yeah. So, I mean, like, if you're watching this, like share this out to your friends who, have young or have babies or they're pregnant or they're kind of prepping a little bit, because this is all really helpful. I think this is great. Also, if you're a chiropractor, I welcome you to make a comment on one of our platforms to help others out, right? Because this is just something that we can kind of collaborate on to learn more. So, okay. So this is what I found out, and I typed it into AI, and this is some of the stuff, because basically what I asked is, does a chiropractor's work help with ear infections? And this is what I found. So number one, it says it improves drainage. So chiropractors can help correct the position of the ear canal to promote proper drainage, which can reduce the likelihood of ear infections. So, I mean, it's exactly like kind of what Dr. Galloway said. Like, I kind of agree, but I also think that you can't really correct the position of the ear canal. And let's just say maybe they meant eustachian tube too. Like, I don't think that you can necessarily do that. But I do think that it could improve drainage if you're relying on their table at that moment. But then the minute your head is back upright, it kind of depends on, how old you are and the degree, right? 10 degrees to 45 degrees. It also says that it helps relieve pressure and blockage. So chiropractors can use manual manipulation and adjustments to relieve blockages in the eustachian tube that can cause pain and discomfort. So possibly, right? But again, how would they get into the eustachian tube to get to be able to?
I think that it's going to say craniosacral manipulation. So if you look at like the bones of the head, you go to get a massage or you go to see a chiropractor, they sort of like sit their hands here at the base. And when you look at, I don't think my model has it. When you look at like a model of a skull, there's like the little sutures where the bones of the skull come together. And babies have that soft spot up at the top. So babies have not all totally fused. So I see how in a baby or an adult, there is a possibility of doing some like really, really minor, movements of the skull that could help. But I also see a door for possible problems.
Yeah, I don't know.
Yeah,
like exactly. I also think that we all have in our mind like this really aggressive kind of chiropractic manner, like they're like snapping your neck.
But not if they're working with babies though, too.
Right.
That's the stuff that makes me,
I'm wondering if there's like some face massaging.
Yeah, like more face massage, or they have the baby like on their stomach, whereas we're not going to be putting them, depending on their age, maybe we're not putting them to sleep on their stomach or their backs or whatever. And so this is just sort of like some positional change, and the professional might feel more comfortable like doing some massage than the parent would. But as far as how much we're like rearranging the bones of the skull and the orientation of the eustachian tube, I think that's.
So again, guys, like if you know a chiropractor, tag them here because we'd love to. We're just talking. We're not like dogging anything. We're just like talking about it, just trying to get it out there. So if you are a chiropractor and you're watching this, then like please comment and let us know what you do because I have no idea. I don't go to the chiropractor, so I'm not really too sure. Other things that they did say that a chiropractor can do to help with ear infections is a little more general, like reducing inflammation and pain, improving balance. So again, if the ear infection has an effect on your balance and you improve the balance, then maybe that kind of can help you. They do non-invasive alternative things, whole body approaches. But here's the one thing that I found, that one study found that 93% of ear infection episodes improved with chiropractic care, with 75% improving in 10 days or fewer. So I thought this was kind of interesting. This was on PubMed, but like if I read it back again, okay, so let's break it down. So one study, right, that found that 93% of ear infection episodes improved with chiropractic care, with 75% improving in 10 days or fewer. So
were they taking
care, or was it the course of the ear infection?
Amoxicillin. Yeah.
So anyway, so that's what I found. There's a lot you can kind of Google it if you want to a little bit more. If you've got any comments, obviously like join the show and comment and put it in the comments, or let us know what you think. But I thought I'd throw that up there and have that conversation here.
I guess
that was quite interesting.
We also have to point out the difference between viral and bacterial ear infections. So let's take otitis media, for example. That can be viral and just come after you've had a virus and your body is fighting that virus, and then it's done with its course and then it's over. Or there's bacterial ear infection, where if there's bacteria back behind that eardrum, it multiplies and it doesn't stop growing and it doesn't get better, it gets worse. And so that's when the infection can move into different parts of your head. And we can kind of talk about times from before we had antibiotics. I'm going to kind of angle this. If you look in that middle ear space there, if you get a whole bunch of infected fluid that fills up this middle ear space and it doesn't have anywhere else to go, it will start to leak into these air cells of the bones of your head. So these little black spots are air cells. And so it's almost spongy. If you go watch an ear surgery and they've got a lot of infection, they go in with a suction and they start suctioning pus out of these holes. And it just keeps coming. It's like insane how much comes out of there. And so to put that into perspective, if these air cells get filled with pus, it can eat the middle ear bones.
Mm-hmm.
So
Erode. Let's use erode.
erode, necrotize,
Uh-huh.
eat any of them, that kind of acidic fluid sitting in there can actually damage the ear structures for good. And back before we had antibiotics, if that infection just continued, it can get into your brain, and you can actually die from an ear infection if you don't treat it. So that's on like the very, very other side of it. But you don't want to just like let something go and just hope that it's going to get better, because if it's bacterial, it in fact won't get better. It will get worse, and worse things can happen than just having an ear infection. The infection can go to other parts of your body, which can be really bad. So we can't just lump all ear infections in one category. And likely if your kid is having recurring ear infections, well, it's hard to say. They could be recurring viral infections or bacterial, but we want to make that indication, because I think that the way that we're treating it should be really different based on if it's bacterial versus viral.
Yeah. Who knew we could sit and talk for 40 minutes about ear infection?
Oh, I can go for longer. So,
the one thing that we didn't mention that I still do want to mention is that, like, we are starting to see people with auditory processing just disorders and difficulties. And one thing that we are finding out in research too is that untreated people that we're noticing, like adults or when they get into college, or people that are coming in to see us, one of the questions that we do ask in our history is, have you had multiple ear infections? And usually the answer is yes for some of these people. And so what they're showing in research is also that for people who have had multiple ear infections, every time that you have an ear infection, think about just having plugs in your ears, right? And you're walking around. And so a lot of the sound isn't getting to the auditory nerve and not getting the signals through. And so people that have had multiple ear infections later on in life, we're finding out that they didn't have that information, I should say, that got to the brain or got to the nerve and then to the brain. And so a lot of the times they have some difficulty hearing in noise, things like that. And so again, kind of just to throw that piece in there as well, make sure that you, if you feel like you have an ear infection, like go get it treated. Try to keep track. If you're a new mom and you have kids, keep track of that 3 and 6 months or 4 in a year. And then don't be afraid of tubes. I want to say, like, when I had my daughter she was like on her third ear infection, and like one more, and I was like, all right, tubes, and like, just don't be afraid of tubes, because that will allow that fluid to drain right away, and you won't have that skip of information. And so we wanted to just kind of give good information out, talk about ear infections. Obviously, we took almost 45 minutes talking about ear infections. But yeah, if you guys have any questions, then please put it in our comments or let us know, and we can get you connected to somebody who can help you in your state. But yeah, anything else, guys?
Nope. That's probably more information than anybody wanted, but I think it's a good kind of, course for all of our, patients that are new moms or patients that don't have as much background information about how the ears work, because it is hard to, make those calls and feel like you're making a good informed choice about what to do.
Yeah. So. All right. So we will be back next week. So to come on and tune in with us or chat with us. Don't forget, like, you can come live with us as well and put the comments in, and we'll chat right back to you. So we'll be back here next week, and we'll see you then. Thanks for tuning in, guys.
Thank you.